Hi and good day. Many of you have been told that you have disc problems, bulging disc, herniated discs, degenerative discs, and they're claiming, the doctor is telling you that you need to get this procedure, you need to get surgery, you need to get something invasively done. Before you do anything, I want you to know that many of these conditions that show on objective tests, like MRIs or X-rays, that show a particular problem, your condition may not, and probably not in most cases, is coming exactly from that pathological condition that they're seeing on the X-ray or the MRI. So there is a condition where the brachial plexus, which is a group of nerves that comes off the spine, that goes right through these two muscles called the anterior scalenus and the middle scalenus muscle, because you have three scalenuses. You have the anterior, the middle, as well as the posterior. But for our sake, the anterior and middle scalenus is where this plexus of nerves comes out that can be irritated and compressed, causing you to have much of your neck pain, pain into the shoulders, down the arm, tingling, numbness, cramping, even referred into the chest or between the shoulder blades, and you're being told it's coming from the disc. So let's see if we can prove the doctors or the clinicians wrong. Now, I'm going to teach you something that's very important because I believe that this may be the answer for you. It's safe, it's effective, and there are no side effects. Now realize that 90% of the nerves that gets compressed in this area, okay, between the anterior and middle scalenus muscle, 90% of it is nerve, 10% is vascular. There are arteries, there is an artery that runs right through that area, but for our sake, we're concerned about the nerve. Now, what we're going to do is you're going to do a simple stretch to release that muscle, to get irritation off that nerve, to allow that pain and that inflammation and that compression to go away. So, imagine that I'm sitting right now and I'm going to take my hand, we're going to use my right side right now, and I'm going to grab onto the chair, the leg, with my right hand, because I'm going to stretch my right side, and as I do it, I'm holding down because I want to compress, I want to depress, bring down the rib on that side, and I'm going to take my hand on the other side, and I'm going to pull it on the other side. Now, you must hold on to that chair or that leg of that chair as you pull over. Now, here's the trick. As you pull over, you'll feel a nice stretch. Now, what I want you to do, so we can get that stretch real good to where it needs to go, is you're going to look up towards the side that you're pulling. You're going to bring your head a little bit back and pull over a little more. And you're going to feel the front part of that scalenus, as well as the middle part of that scalenus, really open up. Hold that about 30 to 40 seconds and you can release. And you can do that stretch 2-3 times. As long as there's no pain, you're going to stretch that side of that neck, particularly where the nerve is giving you pain on that side. You can do both sides. But remember, that stretch is designed to stretch the scalenus muscle out. This is a significant problem that's overlooked by thousands and thousands of physicians throughout the country. Now, with this exercise, you can do this a couple sets. Just hold it 30 to 40 seconds each side. That stretch is very effective to releasing that nerve that's potentially being irritated, that goes into the chest, the shoulder, the arm, all the way down to the hand of the fingers. As I said, tingling, numbness, cramping, pain. It can cause all sorts of problems. Now realize those muscles attached to the first rib, and again the posterior down to the second rib. But the bottom line is that if you're shallow breathing, not breathing out of the diaphragm, you are potentially overusing that muscle. So make sure you're breathing through the diaphragm, not from the chest, particularly those people that are under a lot of stress. Now realize, just that muscle in effect, acting correctly, when that muscle is overstressed, for example, all the prolonged looking down you're doing, typing, texting, bad posture, rounded shoulders, anterior head carriage, forward head carriage, those areas are stressing these scalenus muscles. they're making the condition worse. It's affecting your posture as well. Weak scalenus muscles will affect your neck posture. So you want to make sure that those muscles are not shortened. You want to stretch them, as I said, to get that irritation off, and I hope that makes a tremendous change for you. Leave your comments below. Let me know how you're doing. Please share the video, subscribe, but most important, make it a great day. I'm Dr. Alan Mandell.